Hello, my name is Hongguang Wang, come from China, Jilin Province, Jilin People's Hospital. Today I will introduce endoscopy, single operator cholangioscopy in the management acute obstructive appendicitis, no alternative. Today I will introduce our study. We describe 110 patients, 20 under 21, and 20 under 23 years. We study about 110 acute obstructive appendicitis patients. And we study the complication and the procedure time and relieve the symptoms, abdominal pain. And we use the new endoscopy, just like this. And this appendicoscopy is about 2,200 mm. And this endoscopy, we can pass the endoscopy by colon biopsy channel go into. And this endoscopy can arrive the cecum, and by this light we can watch the appendix orifice, and we can go into the lumen, and we can find the obstruction, blockage. Example, the stone and the soft stone, fecal stone, and we can find the another seeds and bone. So we can find some reason obstruction the appendicitis, and we can watch the inflammation and the pus in the lumen. And before this procedure, usually we diagnose this appendicitis, we use CT and ultrasound. Today we use this endoscopy. We can go into by the imaging and by watching, and we can see inside the appendix membrane color and the inflammation and the pus. So we can use basket and take the stone and use water and irritation inside and cleaning the lumen. So this technique is a new technique and a new imaging. So it's a very good endoscopy. This endoscopy, because the endoscopy regulation direction and left, right can change the direction. When you go into the appendix lumen, and some patients, because the orifice structure, so when we go into, usually is normal, and some patients difficulty, we can use wire. The wire can pass the endoscopy channel, go into the lumen, and we can along the wire go into the lumen. And very difficulty patients, we can use some sphincter and cut the orifice and go into the lumen and deletion the lumen. Then the endoscopy go into some complicated appendicitis. Most patients is easily. And secondly, we can watch the lumen whether have stenosis structure. Some patients have tumor, and we can use this endoscopy. We can have a small channel and go into biopsy. We can take the biopsy, and so the endoscopy can different diagnosis and correct diagnosis. And this endoscopy, when we finish cleaning the appendix lumen, and if the patient have very much pus and very structure, usually we put the stent and 5 FR and 5 cm stent go into the lumen and we can use this endoscopy channel go into the wire, and then the stent go into the endoscopy channel and go into the lumen and put the stent in the appendix. If the patient have very stricture and very much pus and infection very serious, so can drainage very quickly. And usually we examine the patients, the age from 4 years to 17 years, and the patient no heart and another colonoscopy don't suitable patients, we don't do it. And usually the patient have right side abdominal pain, and the ultrasound find fecal stone, and CT examination suspect the patient have stone in the lumen appendix. So if we find the patient, usually we finish it 24 hours, and use this endoscopy can diagnose and treatment the acute appendicitis. Especially we can different diagnosis. Our study conclusion: the endoscopy appears to be feasible, effective therapy in the management acute obstructive appendicitis.